2-minute doc. In today's episode of Know Your Drug, we're going to see about metformin. Metformin has been used as the first choice drug for diabetes mellitus for so many years. Now, how does metformin act? Metformin acts on the liver and suppresses gluconeogenesis, which is production of new glucose from the liver. It acts on skeletal muscle and increases the uptake of glucose into the muscles and thereby storing the glucose in the muscles as glycogen. It acts on adipose tissue and decreases fat production. Now, metformin is excreted from the body by kidneys. So in patients with renal failure, we have to be cautious that it can accumulate in the body and can cause a serious complication called lactic acidosis. Now, if you're an alcoholic who's taking metformin, you should also be concerned that you're also at more risk of developing lactic acidosis. Side effects of metformin. Usually, metformin doesn't cause much of side effects. The common side effects of metformin are gastrointestinal side effects like bloating, abdominal pain, and nausea. These are usually mild and subside over a period of time. However, lactic acidosis is a serious and rare complication of metformin and is common in patients with renal failure and those who are consuming alcohol. The advantages of metformin over other drugs are that it does not cause hypoglycemia, it promotes weight loss, so it is beneficial in obese patients with diabetes, it decreases the complications of diabetes like heart attack. 2-minute doc is a part of the YouTube channel MedVidsMadeSimple. If you enjoyed this video, like, share and subscribe to 2-minute doc for more short and crisp 2-minute videos. Please read the description of this video to know how you can support our channel without spending even a single dollar. You can also support our channel directly by donating on Patreon. The link is in the description of this video. Thank you for watching this video. See you tomorrow in my next video.